it's the next best thing to being in person. So thank you all. I think we have a lot to talk about today. It's been quite an eventful 6 or 8 months in the shelter world in particular, and especially for all of you, I think, trying to adapt your programs. So that is what we're here to talk about. We have a great panel, and I think we have lots of great participants later that can chime in as well. We are going to be talking about the experience of emergency shelter in a pandemic. So very timely. When we chose this session, we had no idea where we'd be at in the pandemic, but we figured that we would be far enough into it that we'd have some lessons and learnings from offering non-congregate shelter during a pandemic. And that's what we're going to be talking about today. So real quickly, we are just a slight bit behind schedule, but not a big deal. We're going to catch up. I'm going to do a short intro and overview of the topic. We're going to have our panelists each speak. We will be asking you to submit your questions, as I believe Rhonda mentioned, through the Q&A box. We're going to do our best to capture those and then send them to ask the presenters to respond to them once they're all done. So as you're going through, you can submit questions, but we probably will not have the panelists answer them until a bit later, once everyone's shared from their program. Then we're going to transition from program-specific questions to maybe a little bit more policy discussion. We think that there's a lot of things that have come up during the last 6 months or a year in shelter that are worthy of having our panelists also talk about. For the post-pandemic, when this ends, what is it that we want to take away and learn? We invite you to be thinking about that as well, because you're certainly welcome to submit comments during that time as well to be part of the discussion. So we unfortunately won't have an open forum for everybody, but we will have, again, that Q&A box for people. So I see a question here about the PowerPoints being available, and I believe that they will be made available. But I'll let the coalition staff answer that. All right, let's move into the introduction. And Katelyn, if you want to go to the next slide. Okay, so we have what I would, I don't know that there are any normal times in homelessness sheltering. I would actually, in hindsight, probably change that term to pre-pandemic. There's nothing normal about sheltering people who are homeless, but during the pre-pandemic time, our office operates at least 5 distinct homeless programs, mostly state funded. So I thought I'd just run through those real quick so people know who we are. If you don't already, we've got the Homeless Youth Act. That's like a multi-faceted program that spans the whole continuum from street outreach all the way to supportive housing. We have transitional housing, state funded, which is more of your medium and long-term subsidized housing with services. We have safe harbor shelter and housing. This is for victims or folks who are at risk or are being sexually exploited or trafficked. And so that's operated in conjunction with the Department of Health. And then we have the programs that are primarily what we're here to talk about today, and also the programs that they fund, which is the State Emergency Services Program, referred to as ESP, often confused with the federal program we also operate, which is the Emergency Solutions Grant, ESG. So we have 2 programs. They work in tandem with other programs, anti-poverty and food programs that we operate. That's enough about the pre-pandemic. The last 6 to 8 months, we've been consumed with $63 million in emergency COVID response funding. So I believe the governor, Lieutenant Governor referenced this in her presentation. We have the funds that we developed an online survey for. These are the funds that you may be getting directly funds dispersed to you through our fiscal agent, Catholic Charities. They have graciously been willing to help us get those funds out much quicker than we could have otherwise. So that is the online survey. We also have the CRF shelter and food funds. So these are federal dollars that came to us. We started to disperse those in June, and they are for much the same purpose as the ESP. And so again, that's through the online survey. Then we had the joy of doing 2 RFPs this year for 2 different appropriations of CARES Act funding. And these were through the Emergency Solutions Grant. So some of you may have applied for those funds, and they covered outreach, shelter, and prevention, rapid rehousing. So a lot of funding going out the door. And much of what you'll hear today is a result of that. It's really increased the capacity in the field to respond. So real quick again, the way non-congregate sheltering, and by non-congregate, I'm typically talking about motel or hotel programs, but we don't just use that term because we also want to include like apartments or other sorts of innovative things that people are coming up with to keep people in sort of separate COVID-friendly environments. In pre-pandemic times, we have just about $844,000 a year in state funds to operate both congregate shelter and non-congregate. So you can see, you know, the 60-fold increase in resources that are being just funneled into the state to try to respond to this crisis. We also, you know, have some federal dollars, but again, they pale in comparison to what we normally, or to what we have now. We have a frequent use of hotel and motel vouchers, but in the past, that's usually been limited to mostly to rural areas of the state that have no congregate shelter. And there's many, many counties in Minnesota that don't have congregate shelter. Typically average 2 to 5 nights stay. And you might have a single household or 1 or 2 households at one time in a hotel. And some of these programs don't offer services. They simply are a safe place to stay. Sometimes there's case management, but very rarely is there any kind of overnight staffing. In the past 5 to 10 years, we've seen a trend towards emergency apartment units that are leased with a little bit longer stays to provide some more stability, especially for families. Now we've had a massive shift, and I'm gonna speed up here so we have time. We have had a massive shift to motel and hotel. And as the Lieutenant Governor said, this was largely initially to decompress our congregate shelters. So we were trying to get people further apart, be less susceptible to the COVID. We also wanted to be able to isolate people who were potential COVID positives and scale up at the same time for the massive or significant increases we were seeing in unsheltered homelessness. Incidentally, some of the motels have also been used to respond to some of the crises that happened this summer with the civil unrest too, where there were large encampments that were potentially in harm's way. So those are some of the ways that sort of the system has had to rapidly expand. And I think that's all of the introduction. I want to get it to our panelists who are going to tell you each about their sort of unique, or we tried to represent different models around the state. So we're going to kick it off with Stepping Stone Emergency Housing and Julie Jeppson, the Executive Director.
I do just want to note for everyone.
Thank you, Isaac. Oh, go ahead.
Sorry, Julie. I just wanted to note real quick to make sure that everyone does use the Q&A box to submit your questions, and Isaac will collect those and then direct them to the panelist towards the end. So any specifics that you do have for Julie or Amy or anyone throughout the panel, please do submit those, and we will get to those as soon as we can. Thanks. All right, Julie, sorry about that.
Not a problem. So thank you, everyone. Thank you, Rhonda and Minnesota Coalition for the Homeless and the Office of Economic Opportunity with Isaac and Katelyn for asking me to participate in today's discussion. I just want to do a little bit of background information about Stepping Stone. I'm kind of use Isaac's platform of pre-COVID and post-COVID, obviously spending more time on post, but painting the picture of pre and what we used to look like might set a better picture as to where we are now. So Stepping Stone Emergency Housing is located in Anoka. We serve the SMAC region, and we are the only congregate bricks and mortar 24/7 shelter serving youth and adults in Anoka, Washington, Dakota, Scott, and Carver counties. We work very closely with our other SMAC partners to provide services and assistance through our critical care and emergency shelter. We, pre-COVID, have a capacity of 66 individuals in an 18,000 square foot facility. In each of our bedrooms, we had 8 people. And so we had about 40 men and 26 women on each side of our facility in each of the wings. Each of those bedrooms has one full bath that is shared amongst about 16 to 24 people. We provide 3 meals a day. We have a computer lab. We have a workout facility. We provide a lot of services and amenities above and beyond just the shelter and basic needs. We are fully staffed with about 25 individuals, 24/7 a day, 24/7 a week, and really provide the basic needs that a individual needs that you and I did this morning, in addition to those critical care services that our residents so desperately need. On April 4 of this year, half of our residents, through a very strong partnership with Anoka County and the state, we moved 33 of our residents to a nearby hotel, which is about 2 miles away from our current facility. So moving all of those people out of the shelter allowed what Isaac mentioned about decompressing congregate setting to encourage distancing. And so right now in our shelter, we have a maximum of 36 residents. So we went from 8 people per room to 4 people per room. And then in addition to that, just the lower usage of the bathrooms has helped significantly. 2 of the rooms, one in the men's wing and one in the women's wing, are our quarantine and isolation rooms. And so when someone comes into the shelters, they stay in those rooms for a few days until we can monitor their symptoms and understand where they came from and where they're hoping to go to. And so before they go into a regular room, they are quarantined and isolated in those rooms, because I'm sure we all realize how lonely quarantine can be and how mentally inhumane it can be. We have used a lot of the funds that Isaac had mentioned to update those rooms to make them a little bit more entertaining, with TVs and DVDs and adult coloring books and games and mind games that people can spend their time doing. So that's the shelter as it is now. We haven't changed our staffing. In fact, we've been able to increase our staffing, which has been great. So right now, the hotel has 33 residents in it. It has limited public, just random people that come to the hotel. So we are basically it at that hotel. We have one of the rooms specifically for staff, for case managers. And so our current case managers, our pre-COVID case managers, are splitting their time between the 2 locations so that their case levels stay similar. We also have one staff person, a hotel advocate at the hotel, to help with just their basic necessities that are day to day. The expectation of the residents are also the same as what they were when they were in the shelter, for cleanliness and keeping up with their laundry and keeping up with their program and keeping up with their paperwork and all that kind of stuff. And so the staff there are really supporting them in doing that. We do not staff it 24/7. It's just not conducive to our capacity at this moment. And we have no plans on getting it 24/7 over there. Next slide, please. So as of end of September, beginning of October, we expanded our footprint within the SMAC region to Washington County. As many of you are aware, a lot of county staff had to really scramble and change their focus to work with those who are in hotels. That's not your day job, that's a service provider's day job. And so we have contracted with Washington County to make sure that their residents who are now in hotels are cared for and provided the services they need. So right now, there are 2 hotels, one in Stillwater, one in Forest Lake. The biggest difference between the 2, our model, the Anoka model, and the Washington model, is that in Washington County, there are children. In Anoka County, we don't have any children. All of our residents are 18 and older. So the other differences are, we still provide case management. We have a housing navigator there who's full-time, but residents have housekeeping. which is really nice. The hotels provide housekeeping and their food is on their own. The Anoka County location, we still provide those 33 residents with 3 meals a day. It's a little bit of a logistical conundrum, but we make it work and make sure everybody gets fed. And we work also with Washington County. We work very closely with Jenny Mason and her team to make sure that everyone is provided the care that they need and the case management they need and the outreach that is required in both locations. So other differences between the Anoka County and the Washington models are the intake process. So for Stepping Stone, in order to get into the hotel, they need to have primarily stayed at the shelter first. We have very high expectations of our residents of behavior and conduct and respect, and making sure that everybody follows just respect and dignity of both residents and staff. And so we really want people to come into the shelter first and then head into the hotel. Where Washington County, they have their host team that provides the referrals into the hotel, and they are screened through the host team. As I mentioned, the Anoka Hotel is primarily us. And so they don't typically rent out rooms to the public, where the Washington hotels do still have the public reserving rooms. Staffing, neither hotel models, like I mentioned, have 24-hour staff, but we do have on-call staff 24 hours. So any urgency that happens off when someone isn't there, we do have a staff person available to walk through some crises if necessary. And also, as mentioned, the populations are a little bit different, with children being served in Washington County. Both counties have very strong partnerships with Stepping Stone. We can't do this in a vacuum. No one can. And so really working with county staff is essential. And having those partnerships with them has been life-saving for us. Each team is pretty phenomenal in their desire to work with these residents and work with us to make sure it works as long as we can. Funding for both models is very different. As Isaac had mentioned, all the various funding opportunities that they have provided over the past, 8-9 months now. We have taken advantage of all those opportunities to make sure that this becomes a reality for everyone and we can make it work as much as possible. Without going too in depth about our funding structure, because at 9:30 on a gloomy Monday morning, that might put you to sleep. But primarily, the Anoka shelter is funded by housing support with a cost neutral allocation. Right now, Washington County, in trying to diversify funding, is also looking at housing supports, just your typical GRH housing support option, to defray some of the costs so that all of the funds from CV1 and CV2 and all of those funding opportunities that Isaac mentioned get stretched a little bit further. So some lessons learned that over the past the past seems like a lifetime now, right? Staff and residents at every level should be involved in decisions. During a crisis like this, like I mentioned, you can't make decisions in a vacuum. So bringing as much knowledge into decisions is essential. Creating partnerships and lasting relationships outside of your community all throughout the state of Minnesota has really helped us through this pandemic. Blair Harrison with the Minnesota Department of Health said those relationships and partnerships that we developed on day one got us to where we are right now. And where we are right now is 0 of our residents have tested positive for COVID. And that's pretty remarkable from the other stories that I'm hearing from other counties and service providers. And we are really working actively to keep it that way. And finally, the communication, over-communicate. Residents need to know that they are safe in the environment that we have for them. Staff need to know that they are being led in a firm direction with leadership that they can trust and are transparent with them. So that's all I had for my section. So I'll pass it back to you, Katelyn.
Great. Thank you very much, Julie. And I'm sure there are a million questions folks want to be asking Julie right now, but like I said, we're going to keep moving to make sure all of our panelists have time to get through what they've prepared. So I'm going to go ahead and pass it over to Amy. Oh, Amy, looks like you're still muted.
Good morning, everybody. Thank you so much to the Minnesota Coalition for the Homeless for having me. I'm Amy Tudor. I'm the Client Services Manager with the Community Action Center of Northfield. So just to give a brief overview, the Community Action Center is an organization that tries to meet the basic needs of the community members in which we serve. So we have a thrift store where we can get folks clothing as needed. We have a food shelf, employment program, we have housing programs, and finally we have an open resource center where we offer our client advocates work to serve all of the individuals and families that are experiencing any kind of financial crisis or in need of some type of support. So prior to the pandemic, we had served about 1,300 individuals and families in the Northfield area, in the Rice County Northfield area. And once the pandemic hit in March and April, we saw a giant spike and have actually tripled and quadrupled our services. So that has made our financial team, all of us actually, a little bit crazy during this time. Prior to the pandemic, our emergency shelter work would have been considered a rather minimal part of what we do. Our food shelf and other financial services were much larger in time and scope and what we were offering. And since the pandemic, we have seen a really large increase. So we have 4 emergency shelter units. These are individual apartments that are owned or leased by the CAC. We serve both families and individuals. For our emergency shelter units, we prioritize families with children, knowing that you know, the effects can be a lot greater on small kids having to bounce around from hotel to hotel. We start with a 2-month stay for each individual or family that is going into one of our shelter units, and then they have periodic reviews to assess if they can stay longer. However, rarely will we exit anyone to homelessness. So we are seeing many times that the folks that are staying in one of our emergency shelter spaces, we are providing 4 to 6 months or even longer of stay, based on the fact that there is not a lot of access to affordable housing in the Northfield area, and many of our clients do want to stay here in this community where their children may be going to school or where they have gotten a job or something. So we have a trauma responsive intake process. So we start our intake process talking about what CAC staff are able to do for the individual. So we go from a lens of, here's what you can expect from us. Here is what we will provide to you, which includes transportation, clothing, food, application assistance, connection to resources, a connection to the homeless liaison at the schools. And we then move into health and safety rules. And then at the end, we ask that they just comply with those health and safety rules and explain that the number one way that they would be, their stay would be terminated is due to illegal behavior. But we believe that when folks are coming from the trauma of being homeless, it helps to hear first that they are being welcomed with open arms and receiving all the support that they can. So that's where we start with our emergency shelter intake. All right, so we also use hotel vouchers and utilize local hotels on a case-by-case basis. So being in a rural area, there is only one shelter that's a congregate shelter in all of Rice County, and that is only serving women and children. So when we see men or families where there is a male in the household, we either have to separate that family and put the male somewhere else. And for individual males, we have to send them to Steele County or Blue Earth or another further away location, which is not always conducive to what they need. So we utilize the local hotels in our area. Again, being rural, there's really only 2 or 3 for us to pick from. So options are really, really limited. We always are running the risk of a hotel saying no or not having room available, which did come up during the pandemic for us. We have to do really intentional work with the hotel staff. I'll be honest, we try to schmooze them a little bit and talk nice and develop some good relationships. We need those 3 hotel, those hotel staff to like us and to be willing to continue working with us. This does offer some flexibility though. So in terms of our funding, we really do try to go with a hotel that is the cheapest per night or by the week. And so if we can't get that one, we do know that we have other options to use other hotels in the area. So our population that we serve is the same for both. So we will also put individuals and families in hotels. We serve, like I said, for the hotel vouchers, we were seeing a really big increase in adult males, single adult males that were needing shelter, who had been living in their cars or who had been sleeping in tents in the area. We do offer hotel vouchers, obviously, to couples, and then our homeless youth. So we we have a host home program here in Northfield, and we try to access that first for our youth, understanding that I think for all of us, putting a youth in a hotel room by themselves feels a little bit risky and comes with some danger, but we do also serve youth in these hotels, and then obviously families, but they get preferred choice at our emergency shelter spots. So the difference for us in the hotel vouchers versus the emergency shelter stay is that in our emergency shelter, like I said, we do offer a 2-month stay minimum. And then for the hotel vouchers, though, we were really only doing 2 to 5 nights in a hotel. And this is prior to the pandemic, I will point out. And the service delivery for us can look a little bit different because we are asking, because we are serving clients for up to 2 months or longer in our hotel, in our emergency shelter units. That means we can do more intentional case management. We do try to meet with them every single week and do a lot more follow-up, whereas with the hotel vouchers, it is as needed. And so we did have folks who checked in, knew that they were going to treatment on Monday, just needed a stay for the weekend and then left. So it felt a little less engaging, a little less connection to those clients. But like I said, we do have the same intake process for both our emergency shelter units and our hotels. So just a few pros and cons that I was looking through. I would say prior to COVID, our hotel vouchers were through Salvation Army funds in Rice County. So we were really only able to serve 1 or 2 individuals or households a month because of the limited funding. So we could put, 2 or 3 folks in a hotel, maybe for a day or two, a night or two. Or we could do 1 week, but then we were using up those funds. Usually they were gone within the first week or 2 of every single month. So an increased funding for us in those OEO COVID funds meant an increased service capacity. And our staff were really excited about the ability to be able to say yes, and that we had the funding available and we could offer some support to these folks who were needing it. That also meant that we were able to provide longer stays in the hotels. So we went from only being able to offer 2 or 3 nights up to a week in a hotel. We started seeing with COVID that people were needing 2, 3, 4 weeks in a hotel, and we were able to provide that, which then allowed us to have more contact and offer some of those wraparound services like we're able to do with our emergency shelter units. One of the problems that we ran into was that we did not increase our staffing. So we have 1 full-time housing case manager. We have 1 full-time youth advocate who works with the homeless youth, and myself, actually, who does the case management for emergency shelter work. All of us also work in our open resource center. So seeing an increase in the need in our resource center, along with the increase in need of emergency shelter, we were taking on a much larger caseload, and obviously, that came with all the things, feeling rather overwhelmed, getting burned out pretty quickly, seeing all of that. It also sometimes meant that we had less in-person contact during COVID. So we work really hard to try and engage our clients, meeting them where they're at, literally in their car, at the park, wherever they need us to. And during COVID, we were doing so much more of our work over the phone or by FaceTime, through email. And that felt much less trauma responsive to us. We all had gotten used to this idea that you kind of have to have eyes on a person to really get a sense of where they're at, and not being able to do that. I would say a month in, we all sort of looked at each other and went, how do we do this better? How do we meet them safely, where they are safe and we are safe? So there was some creative work that had to be done there where we could do some better engagement with these folks. And then the longer stay, as I had said before, that we noticed that with longer stays in the hotel, that also meant that they actually needed more intensive case management. So we were used to this kind of, not necessarily a turn 'em and burn 'em, but we saw lots of folks, if we were only giving 2 or 3 nights or a week, then they would move on to another county or they would figure out other housing solutions. And the longer we had folks in our hotels, they were needing the same level of intensive case management that our emergency shelter folks were needing. And so again, just that increase in services and time and effort, actually. So lots of differences for us. One of the biggest tricks for serving folks here in Northfield is that, like I said, if we are not able to serve them, their other options are usually at least half an hour to 45 minutes away, if not longer. So again, we were also increasing the amounts that we were spending on transportation because we were seeing folks who needed that housing and we were having to transport them to Hennepin County or Ramsey County or Steele County, Blue Earth. So navigating some of that with them as we tried to make sure that they had the supports that they needed. We also work with lots of different resource agencies in the area, and it was nice to be able to, we have a MOST team, the Mobile Opioid Support Team, that offers services to folks who are anywhere on the spectrum of opiate use disorder. And so we found ourselves collaborating much more intensely with our community partners to try and figure out solutions for everyone. And then my final point is just that for us in working with, I know that Julie had talked about cleanliness and making sure that folks were safe. We, one of the tricks about using hotels is that, sometimes the ones that are cheaper may not always have the staffing or the ability to really stay on top of all the COVID sanitation protocols and procedures. So that was a fear for us. If we had folks coming to us saying they couldn't go to an emergency shelter because of risk, their health risk, then putting them in a hotel where we also knew that public health was using this hotel for COVID cases could also feel a little bit risky for us, but best options, and we move forward with having conversations about how that was being done well. So yeah, so that is in a nutshell. I tried to go through that quickly because I think we were running a little bit behind and I wanted to make sure everybody else had time. So yeah, I'll watch for questions, but that's the Community Action Center and our work here.
Perfect. Great. Thank you very much, Amy. All right, I'm going to pass it over to Denise, who's going to talk a little bit about a partnership that Cornerstone has taken on amidst COVID. So go ahead, Denise.
Hello, everyone, and thank you to the Minnesota Coalition for the Homeless for inviting me to be part of this panel. And I've been fascinated to hear my co-presenters here and are giving me some ideas for what I might take back to our own project. One of the things I notice is the differences between the two programs, and in the project that I'm about to describe, we actually have 9 different programs who are kind of trying to merge into one. So you can imagine the challenges related to that. So this project is a collective. In the age of COVID, there is, as many of you know, perhaps know, there are a number of domestic violence shelters in the Twin Cities area here. And many of them came together to put their heads together and try to figure out how to adequately meet the needs of those who are fleeing violence in our state. And so 9 of the 10 programs came together and started talking with Violence Free Minnesota, which is our state coalition, to try to figure out how we could kind of account for the need to provide housing in this difficult time. And so my role is I'm project coordinator. I work for Praxis International, which is a national advocacy training resource center, but we're members of Violence Free Minnesota Coalition and have longstanding relationships with people in the state. So we were asked to come in and help coordinate the project that's funded through ESP dollars. The goal of the project is to aid shelter programs in providing safe housing in this time because of physical distancing requirements in the shelters that some of you have already talked about. We can't house as many people as normally we would. We wanted to be able to provide housing for those who are medically vulnerable, people who might have additional risks related to exposure if they're in a congregate setting. We wanted to have the ability to isolate people who potentially had COVID or might have symptoms of COVID while we're waiting to kind of figure out if people are sick as they go through the isolation period. And then finally, to be able to quarantine those who actually have COVID. So we came together to do this project to provide housing in those situations, and also overflow housing for shelters. You may have seen in the media that the need for housing for domestic violence participants victims of domestic violence is higher because people are kind of stuck at home. And so there is an increase in calls for housing, but also a decreased ability to meet those needs. So as we set up the program, I've often used the analogy that we're building the ship while we're sailing it, or someone said building the airplane while we're flying it, in the hopes that we don't run aground or crash. It's a brand new kind of project that we're setting up here. And so we had to kind of think from the beginning about what might be different about this kind of project as opposed to other programs. It's really important, first of all, that the hotels understand the population that we're working with. Folks have already emphasized the importance of the relationships with people with hotel staff, and we've done a lot to try to nurture those relationships because we're very aware that we're guests. We don't own the property like you would in a domestic violence shelter. And so we're guests in the hotel. And so we really want to work with them closely to make sure they understand who we are, to make sure that we're meeting the needs and the requirements of the hotel, because we have currently we have about 75 people that we're housing, and we want to make sure that we can preserve the right to be there. It's really important that the hotel understand that, there is an overlap between the housing world and the domestic violence world, because many people who are fleeing domestic violence were already homeless or who've become homeless as a result of the violence that they've experienced. And so we really want the hotel to understand that people might be in danger, that the need for confidentiality is really high. We're not going to give the hotel the names of the people who are living there. And so it's really important that the hotel understand that and be willing to do that. Another big point of negotiation with us was whether the hotel would be willing to house people who were COVID positive. Initially in our project, we contracted with 2 different hotels. One hotel was intended to be a hotel that would house those who were medically vulnerable, or those who were housed because of the need for overflow housing. And then the other hotel would be one where we would be housing people who are isolating because they're sick or potentially having COVID symptoms, or might even actually have COVID. It didn't actually work out that way. The second hotel was, the first hotel did not want to house people with COVID. And so for a variety of reasons, we ended up closing that first site, and we now only have a second site where we're contracting right now for 68 rooms to house people in all of the circumstances that I've just described. And another issue that people have talked about is who else might be housed in the hotel. The hotel that we ended up leaving also was contracted with a homeless shelter to provide housing for homeless people. And again, because of the challenges of those 2 populations of people being in proximity to each other, it was kind of creating problems for our folks in terms of the need for confidentiality and protection for folks at our site. So for a variety of reasons, we ended up closing that site. Some other issues were, what about cleaning? And I don't know if any of the rest of you have discussed this with your hotels, but again, the hotel did not want their staff to be cleaning rooms where people could potentially have been exposed to COVID. And so we've had to arrange for special cleaning for those rooms. It's expensive, but fortunately we've not had to use it very often. We've only had 2 people who've actually had COVID. One contracted COVID during the time that she was with us, and another was someone who was in a hospital for reasons related to domestic violence, tested positive for COVID, and came to stay with us for a couple of weeks until she was able to finish with her quarantine period. the people have already talked about staffing, and we also initially were not staffing 24 hours a day. We were staffing 7 a.m. to 9 p.m. And then discovered that we really needed to have someone available. So we ended up contracting with a security firm who would come in and at night. And so they're there from 9 p.m. to 7 a.m., patrolling the hallways, talking to people, you know, kind of encouraging people to stay in the hotel and in their rooms and abide by our curfew requirements and that kind of thing. People have also talked about meals. We do provide 2 meals a day. The hotel provides breakfast. We provide lunch and dinner. We had a lot of negotiations and have ongoing negotiations about how to do that. We need to have meals individually packaged, as I would guess others may be experiencing as well. We also have been trying very hard to provide special meals for people who, for medical reasons or reasons related to religion or culture, need some special meals. I swear I spend half my time dealing with food at times. And so it's a challenge, and yet it's an important thing, because particularly when people are kind of, you know, cooped up in a hotel room and have limited ability to move around in the world, things like food become really important. And then there's this other notion about security concerns that is an ongoing issue that we're still kind of trying to solve. Our folks have either come from a domestic violence shelter or have a relationship to domestic violence shelters. And, you know, in a shelter situation, they're a confined space. Usually the shelter owns the space. It's a locked facility. Typically there's kind of one way in and out. And one of the things that we're discovering is that particularly when there are others in the hotel, that it's very difficult to kind of manage the in and out of the building and making sure that we're knowing where people are and that we have the capacity to provide them with the protection that they need. And in terms of domestic violence, again, it's really important that the hotel understand our population. So we can go to the next slide. Okay, distinguishing between domestic violence and homelessness. Again, these are overlapping populations, but not the same population. And so it's really important to recognize that there's a particular need for things like what some folks are calling case management, and what we would normally call fairly intensive advocacy support. There's a heightened need for confidentiality. As I said, many people, I mean, all of the people coming are fleeing violence. And so we have particular passwords and, you know, all sorts of security provisions that we have for people to have access to the facility. And then there's also this notion of relationships to law enforcement. Many domestic violence programs already have relationships with law enforcement where they, you know, because of the need for the added security, oftentimes there are relationships where the law enforcement notifies the shelter when they're responding to a domestic violence case. And so those relationships exist already, and they can be enormously helpful when you need support from law enforcement. And I think sometimes there can be challenges because law enforcement sometimes has the expectation that we'll share more information than we are willing to share, and actually are prohibited from sharing by state and federal law. So all those considerations are there in domestic violence cases. I did not do a slide about lessons learned. I kind of wish I had, but I want to talk about that for just a minute in the last few minutes of my time. Some of our assumptions didn't really pan out about how we thought this project was going to work. Initially, the way that we set up the program was that the shelters would provide primary advocacy. Initially, all of our program participants come directly as a referral from the shelters. And so the idea was that the shelters would provide primary advocacy, that the staff who were working in the hotel would provide primarily support just for their stay at the hotel. It hasn't exactly worked out that way, I think, to a large extent because, you know, the people who are living at the hotel see the hotel staff on a daily basis, and they don't necessarily have that kind of face-to-face contact with the referring shelter. And so the hotel staff have really had to step up and do more of that direct work with people, helping them find housing and, you know, dealing with helping them get protection orders or, you know, divorces or, you know, connecting with other kinds of outside resources. And so that hasn't really worked out as well as we had thought it would, and has required some additional work from staff at the hotel. Another assumption that we made was that the hotel staff would be pretty easily staffed by people working at the or in the shelters themselves. That the idea was that we heard initially was that because of the physical distancing requirements and shelters then lack of ability to house as many people, that they were at risk of laying off staff. And so they wanted additional work for staff so they didn't have to lay them off. But again, that didn't work out as anticipated, partly because of attrition at the shelter. Some people got sick. Some people felt like it was unsafe for them to work in a shelter in the age of COVID because of pre-existing medical conditions that staff had. And so staffing has been a little bit of a challenge. We have to rely on the shelters giving us staff, and we're constantly kind of beating the bushes to find people to come in. And then what that has meant is that we sometimes have a lack of consistency with people on site. And so kind of keeping up with the whole notion of new people coming in and working with people in the shelter, in the hotel, has been a bit of a challenge. Another thing is that I think we didn't anticipate in the beginning the need to pay attention to what would be happening with children. We're housing both adults and children in our hotel. We serve all genders in our hotel, and adults and children, including teenage boys, which is sometimes a challenge at shelters. And I think one of the advantages of using a hotel setting, and that is that since people have private rooms, mothers fleeing domestic violence don't have to make the choice of whether they are going to leave their teenage boys at home or go to a shelter and be safe. So we've had a number of teenage boys as well. But I think, the whole schooling thing was really a challenge in the spring. And I think, to be fair, the schools themselves were scrambling to figure out what to do. We've done a little better, I think, this fall, but it's something to pay attention to, and something that's really always on my mind, and I'm always wishing we could do more. Others have already talked about the challenges of dealing with isolation in the hotels, because in a congregate setting, people are at least seeing each other. In a domestic violence shelter, there are support groups and other activities that people are able to participate in. And of course, even having the space to do that, or having to allow for physical distancing, and also whether there's space that exists in the hotel to make that possible, is really been hard. And then finally, the last lesson learned, I think, is just the whole notion of the challenge of moving people to more permanent housing in the age of COVID. Thank goodness for the eviction moratorium that has, I think, saved a lot of people's housing, in the last, 6 or 8 months. But I sometimes wonder if at the same time it's the unintended consequences. I wonder whether landlords are being more selective in who they are taking in, because they know that they can't evict a problem tenant as easily. So it's been kind of a challenge. We have had some really good successes, though. We've had some people who've been with us from the very beginning when we opened our doors last spring, who are finally finding housing. They're kind of difficult to house. They've circumstances that make them more difficult to house. And so we're finally moving some of those people out to something that's more permanent. Some people are there for a night or two, as others have mentioned already, but we're finding this challenge in moving people to more permanent housing. And with that, I'll stop talking.
Could I just clarify something that you referenced the hotel staff doing more of these services, and I just wanted to clarify, because that was something that confused me when we were talking earlier. You don't mean the actual property staff, you mean like staff you had hired to be at the hotel.
Yes. Thank you very much. Yes, when I'm referring to hotel staff, I'm primarily referring to the staff that the shelters are contributing to work at the hotel. Yeah. Sure. So we're making a distinction between people who are working at the hotel and people working in shelter. So I apologize for the confusion.
Yeah, I just want to be clear, we didn't have like the front desk staff doing stuff. Yeah.
And that is kind of one of the challenges, and that's kind of people, figuring out what they go to the actual hotel staff for and what they go to the hotel advocates for, and kind of, that's one of the reasons why the relationships are so important between our programs and the actual hotel staff, because it can get a little overwhelming for everyone.
Okay, thank you very much. All right.
Great. Thank you very much, Denise. All right. And last, but certainly not least, I'm going to hand it off to Jordan May with the Red Lake Homeless Shelter to be our final presenter for the panel. So go ahead, Jordan.
Good morning, everyone. I'd just like to thank MCH for allowing me to coordinate with Isaac and Katelyn in order to do a presentation on some of the program and development that we've been doing. So obviously the Red Lake Homeless Shelter is an emergency shelter. We've been open since January 1st of 2006. And, you know, with COVID, you know, at the moment right now, because of social distancing, I had to, you know, decrease the amount of people that I can serve inside my my shelter, because it's a, you know, a small building, only 7 rooms. So typically, you know, we can house around 20 to 25 people, and usually it's pretty full around that number year round. So I decreased that number by half just to make sure everyone's safe. And actually everyone that comes into the hotel or, you know, tries to receive services from our emergency shelter, we actually, you know, have them, you know, do a pre-screening to make sure that they're not positive for COVID. So everybody that is going into our current emergency shelter is negative and is going into kind of like a quarantine lockdown. So we do have staff 24/7. And what you see here is actually a new sprung shelter that is being developed right now. And it's directly behind the actual current emergency shelter we have, because the Red Lake Nation did receive some federal CARES Act money. So this was actually one of the sprung shelters that was used, that the Red Lake Nation used during the navigation center when, you know, they had the homeless encampment. So the Red Lake Nation purchased 3 of these, and there's 2 of them connected, but one's going to be for more emergency shelter, because, you know, during this COVID, the number of people trying to request services has greatly expanded, just because of so many people being doubled up, you know, and there's just not enough housing stock on the reservation. So with this new sprung shelter, you know, we're actually going to just house single adults in this right here, males and females. I'm probably going to have around 8 to 10 bedrooms. And part of it though is, you know, I'm trying to utilize some of the, you know, the actual CARES Act money that I have in order to get it fully operational. We did apply for some, you know, some of the ESG CV1 funding, and, you know, we did receive funding to pay for all the staff and operations for 2 years. So kind of part of what this goal is to, you know, with some of the actual ESP funding that we actually received as well, is to develop this hotel to home transitional housing project. So ultimately, the goal is to, you know, house some of these single homeless individuals directly from the sprung shelter, to transition them directly to the hotel to home project. And as you can see, you know, we're actually staying at a local new hotel. It's kind of like a suite where, you know, it does have a fridge and a dishwasher, a kitchenette. So you know, people are actually able to provide their own meals and cook their own meals, and kind of you know, develop some of those individual life skills that people need in order to you know, become self-sustainable. So the objectives of this is to provide emergency shelter in a hotel setting and transition people from homeless into permanent scattered site housing. We're trying to reduce COVID-19 exposure for homeless at-risk American Indians in the Bemidji area who do not have a safe space to self-quarantine, provide routine screening to identify symptoms, enroll individuals with public assistance benefits, medical assistance, housing support, you know, GRH, cash assistance, and food, you know, support. So we actually generate revenue from a variety of funding sources, Medicaid, housing subsidies, and grants. So provide chemical dependency, mental health, and medical assessments to connect individuals with wraparound services, provide clients with education and training to prepare them for independent living. Utilize grant funds to develop a scalable and sustainable permanent transition housing program. So after the people actually get into the actual hotel, we actually just develop the programming in order to transition people into housing support, so then they can live independently and receive that subsidized service. So obviously, we're providing hotel rooms for homeless American Indians to support individuals who would otherwise be unable to follow social distancing and self-quarantine practices. Program participants will receive on-site routine services to identify COVID-19 symptoms early. The program model is to do recruitment referrals. Obviously, we want to try to transition people directly from our emergency shelters to the hotel to home project. We'll do the intake registration, the orientation, temporary emergency hotel shelter, then to permanent housing with housing support. So participants will be identified by the Red Lake Homeless Shelter via agency referrals by tribal and local social service programs. Some of the clientele that we are trying to identify are older adults, people with compromised conditions, pulmonary conditions, or other health issues. Our staffing actually includes, because when I first started this project, I started it individually myself, and I just did not have enough staff there 24/7 right away. So when I started this project in August, I was working some long hours. I was averaging anywhere from 60 to 80 hours a week, just doing all the program development and hiring all the staff and everything like that. But the hard work paid off. So I have, a hotel manager that is on site with hotel staff that are there 24/7, 2 part-time, 2 full-time. I have 1 community health worker and 2 case managers. So that is kind of one thing that we noticed, because we actually have 10 rooms, but we're probably looking to expand to 15 just because of some of the money that we receive from OEO. And it's ongoing work. It requires a lot of one-on-one time with the clients, providing all the case management, providing all the referrals for landlords and things like that. So a lot of the clients that we are dealing with, some of them have criminal history, chemical dependency issues, certain things like that, just requires more time and ongoing one-on-one case management in order to successfully be able to transition them. Currently, we are at a capacity of 10. In October, we actually housed 5 people that we transitioned into the actual Red Lake Homeless Shelter housing support program. We had 2 discharges for non-compliance of rules. We actually worked very closely with the hotel to make sure that all our clients and are following all the exact rules that the hotel has in place. And then we have specific rules too that clients have to follow in order to maintain their housing with the whole hotel program. For the most part, it starts out a little slow. Clients are not willing to engage and kind of do the extra work that we need to do. But after you make that communication connection with the clients, they engage more, and then they're willing to participate, because it takes a little while to try and see what the program has to offer, because the Red Lake Homeless Shelter has only been specifically emergency shelter. And then we have several grants that we administer to provide direct assistance services, rental assistance services. So it's one thing that I noticed on the reservation, that there just really wasn't any resources to try and service single adults, because a lot of the programming that we have in place is specific for families. So this is one way through COVID and the actual available funding that we're able to develop specific client service, population services.
Jordan,
Yep.
we had a question for you here from somebody. In fact, and they were wondering if you could just say a little bit more about how people are assessed and get into the program. And I think specifically we'll just have you focus on how do they get into the hotel to home project, because that's kind of the non-congregate model that we're talking about. So those singles, how would they be assessed to get in that?
Okay, so you know what we did do is we are actually we are screening people over the phone just to see if they meet the specific criteria that we're looking for in clients. And then what we do is actually set up a time to actually meet with clients directly in the whole hotel, because after we do a pre-screen, and then more than likely we'll be able to validate that they meet the criteria that we're looking for. At first, the program started a little slow, so I actually had to go out and do the actual outreach, and around in the Bemidji area, I was able to locate some of the clients that were sleeping under the bridge, or try and then do outreach through program sharing and things like that. So it started a little slow, but now, we actually have an extensive waiting list. So we got about 15 to 20 people waiting to actually get into the program, which is why we're actually looking to expand services now that we have a good staffing model in place. And then clients are, getting referred to us from, local service providers. There's other programs that are looking to exit clients from treatment facilities and things like that, where they've already, had some extensive case management, and they are kind of, aware of the quarantine rules that we have in place a little bit. So then, we're able to coordinate services and transition people from our, that service to this service, and then on to their own housing. So. Just a lot of communication, coordination, and collaboration between all the local service providers. This is probably the first time that I've gotten directly into the Bemidji area providing services. Usually, I just provide rental assistance in that area, but this new not congregate. This whole hotel program, it really expanded a lot of knowledge that I've learned. And then through the actual hotel staffing that I have, through the OEO grant, I've been able to learn a lot of the knowledge and resources and everything like that in the area, which is very vital to, provide these much, needed essential services.
Thank you very much, Jordan. We are going to put the contact information for the panelists. We haven't gotten a lot of questions for the panelists, so maybe people are just holding back, or maybe I'm sure they did such a great job that they answered all your questions even before you had them. So feel free to continue to ask questions, but we are going to go on to the discussion now. We've got about 10, 12 minutes left. And we don't have to hit all of these, but these, some of them I think we've sort of talked about a little bit in the course of the presentation. But I have asked each of the panelists sort of to take a question and maybe just share briefly your thoughts on it. And then if other panelists want to join in, feel free, so you can unmute yourself as needed. I'm just going to start with the sort of lessons learned that you think might be able to be applied post-pandemic. So what can we take from this experience when this horrible thing is over? And I forget who I asked to answer that, but if you know who you are, you want to just chime in and start with that. We'll just kind of kick it off with that.
Well, this is Denise, Isaac. I'm the one that you had asked to respond to this. And I have to say that, years ago when I first started working in this field, I worked in a congregate setting. I had not done shelter work for probably close to 30 years when I was tapped to coordinate this project. And I know that whole world has changed a little bit quite a bit since I did it many years ago. But one of the things that I've certainly learned from this is the importance of flexibility. mean, things rarely work the way that you thought they were going to work the first time. And so, you know, we've had to make a ton of adjustments as time has gone on. You know, I've certainly taken, even though I haven't done this work in a long time, I've taken a lot of advice and feedback from those who have. And so I just, this idea of building the ship while you're sailing it, I think is probably apropos for a lot of this kind of work. And another thing I think is just I've really been reminded of what social beings, human beings are, and how important it is to, from the very beginning, be paying attention to how we can meet people's needs for social contact, even when we have to be apart from each other. And there's some of that I think that can apply even post-pandemic and even in a congregate setting, because, you know, in the world that I operate in, the need for confidentiality and being careful about who has information about you and how it's shared, the reality that in a congregate setting or a non-congregate setting, that if people are sick or there are other reasons why they can't be as close as they want to be, that it's really important to pay very close attention to those kinds of things. And then finally, I keep thinking about the kids and the reality that the needs of the children often in both congregate and non-congregate settings, I think, don't bubble to the top as often as I wish that they would. So I guess with that, I'll stop.
Yeah, thank you very much, Denise. I really appreciate that. Sort of on a related question, I guess, is how we would change our shelter responses. And this could be both congregate and non-congregate. And I think some of what you said that could be strengthened sort of after the pandemic. And I think it might have been, was it Julie that I had asked to take that one?
I wasn't, Isaac, but I'm happy to answer it,
unless
you want the other panelists to.
I apologize. I have too many things going on here. Maybe Katelyn.
That's fine.
But yeah, go ahead.
Go ahead, Julie. That would be great.
Oh,
that's great.
Okay.
It doesn't really matter. I just didn't want silence when I asked.
Yeah. I think the biggest change or the biggest change for us post-pandemic is that it is clear that we could not contain so many people in one area. It's not humane. It's not hygienic. It's not how human beings should live. And that has never been more clear with what's going on right now. We need to be compassionate and empathetic to human beings, and keeping them in a very overflowing building, it's not helpful. And from my perspective, other people are finally starting to realize that. I mean, before COVID hit, this past January, February, like right before COVID hit, we had massive amount of flu, norovirus go through our shelter, and it was awful. And human beings should not live like that. And we need to work together on so many different levels to ensure that we don't go back to what we were, even though these hospitals, the hotels are incredibly expensive and just not financially feasible for long-term sustaining. We need to do better. We need to figure this out, because going back pre-COVID is not a solution.
Great. Thank you. And we got some totally agrees on the chat feature, or I mean, not the chat, the Q&A feature. And we had people talk about well, anyhow, I'm going to go ahead and go on to the next question while I read this. I'm trying to go back and forth. But let's go with what the longer shelter stays and sort of the challenges with that. I think, Amy, I'd ask you at the last minute, because I know your program was making some transitions around that, and you sort of touched on it. But
absolutely. Yeah, so I'm just going to speak to what Julie said about being more humane and the humanity of people. And I know that for us, we really wrestled with having such limited funding and the capability to just put folks in hotels for a night or two, knowing that that just means they're bouncing around over and over, you know, trying to kind of puzzle piece where they could stay. So calling out friends or family if they had them available, and figuring out another hotel they could go to or another area they could live in. And it did feel really inhumane to do that work with such limited capacity of funding. So for us, the longer shelter stays just felt like we were more empathetic, that we were more compassionate, that we were able to really help them in gaining some stability. And again, to Denise's point about children, that we noticed that greatly affects children and their ability to do school and stay connected with the friends and supports that they need for us if they're bouncing all over the place. Obviously, one of the things that we lose from the longer shelter stays is just that we have less capacity to serve more people, right? So the fact that we were giving longer stays didn't mean that we had less of a need. We were still getting high numbers of folks coming in. And so those were two of the things that we noticed for ours. And we really tried to balance our limits, our lengths of stay based on, you know, what other options were available to them. We had folks who were wanting longer hotel stays, but they had the option to go to a congregate shelter, and we did feel like it was safe, and we did feel like they had the means to do that. And so if they, you know, always trying to balance for us, how long we let someone stay, what other options they had. Obviously, police involvement made a big difference for us if it was affecting our ability to have a positive relationship with the hotel, things like that. So.
And I recognize that we're running out of time. So I just want to, Katelyn, you look poised to say something.
I just wondered if we could spend just a couple minutes on that last question, just about how emergency shelters and policymakers can really try to sustain this energy and attention to the role of emergency shelters in a public health response. And so I open that to any panelist, but wondering if anyone would be willing to share their thoughts on that.
I can jump in on this one, and then you know, if anybody else wants to you know, follow up with it, you know, because you know, I've been running an emergency shelter since I became the director in 2014, and you know, it's a learning lesson, you know, of how many things go on during people's lives and everything like that, and the importance of you know, an emergency shelter is, you know, and then you have to, you know, make sure you inform those policymakers, you know, because there's just not enough funding to actually operate emergency shelter, let alone create new emergency shelters, which is with the high growing need because of so many people becoming homeless. And you know, the actual role that it goes into, you know, to actually you know provide that safety and, you know, public health that people just do not have, you know, because they are homeless. So we really need to try and, you know, find ways to generate, you know, some more capital revenue in order to actually develop these new emergency centers.
Thanks. Thank you. And specifically, I guess, around like your local public health, like, you know, what's I think that will change for any of the panelists. I know it depends a little bit whether you're in the metro or rural areas, but if you had any kind of local public health relationship developed through this, what can we do sort of going forward?
This is Denise. I think it's really important to take as broad a view as we can of this. I am outraged that there are so many homeless people in our state and in our country every single day. And, you know, and it has so much to do with the way that public policy and allocation of funds work in our country. And I think that, you know, most of the solutions that I see being proposed are to, find another, 100 or so units of low-income housing or something like that. And of course, that's good. But when we look at the numbers, I mean, I think the first slide you talked about 20,000 people being homeless in our state every single night. I mean, that's not a sufficient response. And so I think we have to really urge and encourage our legislators both to put money into affordable housing that's actually affordable, but also to really look at, issues like income inequality and that kind of thing that really, lack of a social and medical structure that doesn't permit us to adequately meet the needs of people with mental illness or chemical dependency or a variety of other issues. So I think we have to really take as broad a look as possible.
I'll just make a quick note that somebody chimed in on the Q&A that said that it helps. One of the positives of this is that that's helped with sobriety, they said, by giving people more space and keeping more clear boundaries. They feel like that's actually been a benefit of sort of the non-congregate, I think. And someone said they developed a new relationship with County Public Health and Emergency Management, which they did not have in the past. I think they'll have that going forward. So any sort of like, I want to give the coalition time to wrap this up, but any a last thought on public health specifically. I know we've covered a lot of ground today, but hopefully we got some people thinking, and there'll be some, this will be recorded, and so there will be some takeaways, I'm sure. All right.
I want to add one last thing there. Just like you said from that last question, you know, like our actual programming and programs up here on the reservation never, really worked with the county at all before COVID, and now we have just a great connection with them now in order to provide those much needed services.
Great. Thank you, Jordan. Well, we're happy to hear there's some positives coming out of this experience, as difficult as it's been for everyone. I just want to thank the panelists so much. We know this is not the format we're all used to, but I think for a first time, I think we all deserve, some thanks for trying this out. And I think we did all right. Hopefully people feel that way among the participants. And I'm going to pass it back to Katelyn just to wrap things up, and then the coalition.
Thanks, everyone. I just wanted to note that Isaac and I's contact information is up here on the slide. The panelists' contact information will be available in the slides as well. So please don't hesitate to reach out for any follow-up, or if you have any funding specific questions, please do go ahead and contact Isaac and I will hand it over to Rhonda.
Thank you, Katelyn, and thank you to all of our panelists for sharing your insights and taking time to think deeply about how we work together and we advance solutions in our communities and we overcome the challenges in the current pandemic. I want to remind you that we have another session at 11 o'clock, and that will be with the Institute for Community Alliances. And that will be more about the HMIS system and turning data into insight. We hope that you'll join us again at 11, and then we'll be back here again at 9 o'clock in the morning. So thanks again to all of our panelists and for everyone participating on Zoom. I hope you have a great day.
Thanks, everybody.
Thank you.